the concentration of intracellular space, which is going to cause a pull of fluid from the intravascular space into the intracellular space. And I've already told you the form of edema that involve the intracellular space is cerebral edema. The form of edema that involve this intracellular space is cerebral edema. Is it clear? And in order to relieve that cerebral edema, we have to use now an anti-edematous. And an example of anti-edematous is mannitol. Is it clear? So those are the elements that you have to put in mind when you are giving the management of the complications. Now, the next complication that we have in this case, you have also hypocalcemia. Hypocalcemia, you have to give the patient calcium gluconate injections, but you have to always be cautious. A patient that has a hypocalcemia, a prolonged hypocalcemia, should not be replenished fully with calcium and very fast with calcium, else it's going to have a rebound effect. Is it clear? A patient that has hypocalcemia, is it clear, should not be replenished excessively very fast. Is it clear? Because if the patient has hypocalcemia, the body has to adapt itself for the reperfusion into the other three compartments, else the patient is going to have a sudden hypercalcemia. Is it clear? Which is going to cause the death of the patient. So you have to replenish the patient only with 1 ampoule of calcium gluconate and not more than that. Is it clear? And then you continue only with the oral or the oral form of calcium. For the osteodystrophy, you just need to manage for the calcium, and you also need to transplant the patient. That is in the case of the management of chronic kidney disease. So this one is not more in this level. Now you need to understand also that you can have hypocalcemia in acute kidney injury. Is it clear? You can have hypocalcemia in acute kidney injury in different circumstances, and those circumstances include when you have a tumor lysis syndrome. So when you have a tumor lysis syndrome and when you have a rhabdomyolysis. So those are the major circumstances where you can have hypocalcemia with acute kidney injury. Is it clear? So those are the different elements for the management of acute kidney injury. Now since we are finished with the complications of management of acute kidney injury, we now go down to the management of the cause of acute kidney injury. Now, generally, this is not going to be taught by many nephrologists. So, for the cause of acute kidney injury, I'm just giving you one of my secrets, the secrets of SchrDbb. You need to know that generally, when you have a glomerulonephritis, is it clear? You have to treat them with steroids. A patient that has glomerulonephritis has to be treated with steroids. Example, high dose steroids like betamethasone 120 mg. Is it clear? 2 times per day. Is it clear? So when you have glomerulonephritis, like in the case of a minimal change disease, a mesangial nephrosclerosis, all that you need steroids that you have to apply at the level of the glomerulus. Is it clear? So in order to reduce the inflammation there, when you have interstitial nephritis, also you need to give the patient steroids. When you visualize that the patient has interstitial nephritis, you need to give steroid. But in this case, steroids has to be given at a lower dose, like betamethasone 60 mg 1 time per day. Is it clear? So it is at lower dose steroids, and you have to, after managing the glomerulonephritis and interstitial nephritis, you should also manage the underlying etiology. If it's a toxic product or all that, you have to manage the underlying etiology. Is it clear? Now the next one is for acute tubular, is for tubular or tubular interstitial. When you have a problem with the tubules, when you have a problem with the tubules, is it clear? Generally, you don't need steroids. What you need is you need to perfuse and deperfuse theory. I call it the perfuse and deperfuse theory. Is it clear? So perfuse and you deperfuse, meaning that what? It means that you this is how you are going to activate the tubules back. It means that you give the fluids to the patient and then you give diuretics to the patient. Is it clear? Such that they should be in equilibrium, so that there is no fluid overload, nor there is no dehydration. Is it clear? This mechanism is going to activate back the tubules by a principle of perfusion deperfusion mechanism. Is it clear? Still under SchrDbb, perfusion deperfusion. So you give fluids and then you give diuretics such that it should be in equilibrium, so as to prevent that the patient should have pulmonary edema, nor the patient should be dehydrated. So you have to monitor the urine output at the exact time and monitor the fluid exactly, such as to prevent any fluid overload or any dehydration. So that is for the tubules. And then you have to manage now for the different risk factors. Is it clear? So that is how we manage patients that has different one. Now the last one is to manage the vascular, provided that there is vascular injury, like in chronic kidney disease. Is it clear? Generally, vascular injuries are going to manage surgically. Is it clear? Vascular injuries are going to be managed surgically. They are the repair of the vessels for the reperfusion. Or other techniques is that you can use also reperfusion techniques. Is it clear? Reperfusion techniques, like in the case of thrombotics, you use antithrombotics, because we have explained that one of the mechanisms via which you can have vascular problem was endothelial damage and thrombus formation with thrombotic microangiopathy. So if you use antithrombotics, is it clear, it can help you to reperfuse at the level of the kidney. So you can use anticoagulants, is it clear, like heparins, and you can use you can use fibrinolytic like tissue plasminogen activator. You can use anticoagulants, you can use aspirin, low dose aspirin. All those are antithrombotic that is going to declot agents. Is it clear? So for vascular theories, you are going to use is much more surgical, and to reperfuse you use antithrombotics. Is it clear? So those are the different elements that you have to visualize here. Now, after visualizing all this, we now end up with the follow-up.